The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy, a local Health Mart pharmacy. I'm your pharmacist, Paul White. We're glad you joined us this morning. Before we begin, I'd like to thank Mercy Medical Center, Studio Arts and Glass, and of course, our technical producer, J.D. DeAngelis. In the studio with me is Nancy Warmby, Executive Vice President of Medicine Center Pharmacies, and our very special guests, Dr. Russell Ramey and Cancer Nurse Navigator Angeline Barbado from Mercy Medical Center. Good morning and welcome to the show.
Good morning.
Good morning.
March is National Colon Cancer Awareness Month, and we are helping raise awareness and joining the effort to help save lives. According to the Colorectal Cancer Alliance, colorectal cancer is the third most commonly diagnosed cancer, and it's the second leading cause of cancer death in men and women combined in the United States. Family history, ethnicity, and race can put you at a higher risk for colorectal cancer. So screening is an important factor to help you stay healthy. Early detection is key, and today we're going to talk about detection, treatment, and more. We'd like to remind our listeners that today's program is also available on our podcast, which can be downloaded from the App Store on your mobile phone. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. If you have questions you'd like addressed during the program today, post them on our live Facebook feed or call us at 330-450-1480.
So, Dr. Ramey, this is a return performance for you, and we're happy to have you back. And Angeline, could both of you tell us a little bit about yourselves?
Sure. My name is Angeline, and I am actually the Colorectal Cancer Nurse Navigator at Mercy Medical Center. So I am a registered nurse with an oncology-specific background, and as one of the navigators, I am there for assistance for our oncology patients during their cancer diagnosis.
Sure.
I'm a general surgeon and robotic surgeon, and also the surgical director at the cancer program at Mercy Medical Center.
Okay, how long have you been there, Doctor?
25 years.
Oh, gosh. Okay. You've seen several building projects and all that sort of thing.
That's a fact.
Okay. So I understand March is National Colon Cancer Awareness Month. Why is this such an important focus?
Well, it's important because we can definitely use this month to just raise awareness about colon cancer, take action towards prevention of the disease. It's a very curable and preventable disease, so if we can have an opportunity to speak with our family, friends, and the community about the screening process and encourage them to go ahead and get screened, it's great. You know, in the community, there's a lot of attention in the media on breast cancer, and women take that initiative to get screened for breast cancer, so colon cancer needs that type of awareness as well. So that's why we are here today.
So can you tell us what colon cancer is and how common it is?
Well, you have the statistics, and colon cancer, basically, like all cancers, is an unregulated growth that in this case starts in the colon or rectum. There's usually a genetic defect that leads to the initial development of the cancer. It grows progressively, first locally within the wall of the colon, and then, if not treated, extending to lymph nodes and then distant sites.
So, in hearing you explain that, it sounds like genetics is the most important factor?
It is, as far as tumor development, but that's different than somebody's familial genetics. The genetic causes that we know of that run in families are by far a minority cause for cancer, but many stresses to the lining of the colon and rectum will initiate DNA damage.
So if colon cancer is so very common, why don't we hear much about it?
Well, we definitely hear a lot about it in the hospital, but unfortunately out in the community, people are just embarrassed to talk about it. You know, no one wants to talk about symptoms that might worry them, like having irregular bowel habits or blood in the stool. So the cancer experience itself can be overwhelming. So having that on top of the sensitivity of the subject just makes it so that they're embarrassed to talk about it.
You're probably too young to remember, but I remember when Katie Couric had her live colonoscopy after her husband passed away. Did that make a change? Did that start to make people less embarrassed?
I think it did. I think the more people talk about it, the more you see public celebrities discuss it, I think it takes the stigma away.
Do we know what causes colon cancer, and is there anything preventative that we can do?
There are numerous causes. Certainly, most of them are environmental. We know dietary issues that lead to colon cancer. Also, hormonal things, which is why weight gain is associated now, especially in our society, with an increased rate in young people. Regarding prevention, the best preventative for colon cancer is actually getting colonoscopy. In most cancers, our best hope is early detection. But when you consider it, in colon cancer, we actually prevent it by taking out precancerous polyps. Those of us who do colonoscopies, every week, and some of us every day, will actually be preventing colon cancer.
So my father-in-law passed away from colon cancer at the age of 60, so a very young age, and he worked in a steel mill. And I always wondered if that was in any way a contributing factor.
It may be. Environmental causes mostly are dietary and alcohol and tobacco, but certainly people are exposed in industrial situations to other things that they ingest, not even knowing that they've ingested them.
Types of there are different types of colon cancer, correct? I guess where I'm going, I've heard over the years some people say, "Oh, I went had a colonoscopy and I'm just full of cancer," and da da da. Or I had a colonoscopy and they just found one polyp. Okay, and they took it out, and now I don't have to go back for another colonoscopy for 5 years. Is it?
Sometimes. So, Paul, you're right. There are several different types of colon polyps. Colon cancer is kind of final common result of the polyps if they're untreated. So different types of polyps have different predilections to turning into colon cancer. So if somebody has lower risk polyps, then they may not have to have another colonoscopy for 5 years. If they have higher risk polyps, it may be 3 years. And so it depends on the type. But the colon cancer itself is a common type. It's all adenocarcinoma.
Is it slow growing? Is that why there can be such a length of time between colonoscopies?
It typically is very slow growing, which it gives us plenty of lead time. So by the time somebody actually has colon cancer, they've probably had polyps for a matter of years that were just undetected and therefore untreated.
So you mentioned weight in the early conversation here, overweight. Contributory to colon cancer, or
Definitely.
You already have it and the excess weight exasperates it, or
That's a great question, actually. We don't have data to suggest that once it's developed that is a poor prognostic indicator. We do know, though, for the development of colon cancer that it's very key. So now, for example, we've decreased the age at which colonoscopy screening should start, just based on the changes that we've seen in our population. We see more cancer in younger people, and it's tied heavily, not pun intended, to weight gain. Certainly the lack of exercise in our population also contributes to that. We have excellent data to suggest that exercise decreases risk for colon cancer, and actually for most cancers.
So have we seen any progress in dietary changes in people? I mean, we keep hearing, okay, more vegetables, more fiber, more, less beef or less meat or pork or whatever. Any progress being made?
I think so. I think that there's increased scrutiny on our food industry. Clearly, the move to less people eating at home, more people eating out, makes that even more important. We know that populations that have higher intake of red meat, of animal proteins in general, have much higher incidence of colon cancer and rectal cancer.
As I drive home at night, past all the fast food restaurants, you see huge lines of people in the drive-through lines picking up dinner to take it home. Is that good? I mean, okay, fast food is. Sometimes there's nothing else to eat. I mean, or you don't have time to eat. So how do you?
It's inconvenient to eat well.
Yeah.
Just like it's inconvenient to exercise.
So what about some other lifestyle changes? that we can do?
Yeah, and basically, as Dr. Ramey had said, those healthy habits are just promoting a healthy lifestyle. So just encouraging our patients to stay healthy, eat a healthy diet full of fruits and vegetables, higher fiber, trying to avoid red or processed meats. The good thing is that type of diet and healthy habit is really what we would recommend for someone for the prevention of just heart disease or diabetes. So it's really just that overall healthy lifestyle that you need to try to maintain.
So when should we start getting screened for a colonoscopy, age-wise?
Well, the American Cancer Society now does recommend the average risk patient to get screened at 45 and continue that screening until the age of 75. However, there still are some organizations that recommend the screening at age 50. So we just, educate our patients and encourage them to have that conversation with their physician so we can really determine their risk level.
Is that different if you have a family history of colon cancer?
Yes.
It is. It also differs on ethnicity and gender.
Which gender is the most prevalent?
Males.
Okay. Women, because do we know? I mean, they all eat the same stuff.
Yeah, it's not known actually.
So the gold standard is colonoscopy. Okay. What else do we have?
Now we actually have very sensitive stool tests that detect specific DNA sequences within stool that are unique to advanced polyps and colon cancers.
So what's next?
I think that field is going to explode in the near future. I just would never encourage somebody to wait for the next big development because you never know the timeline. But I think that we get better all the time at this. I think that we're on the brink of some much larger changes with our ability to screen and detect these early.
So can you tell us about the colonoscopy procedure?
The procedure itself is usually not what somebody struggles with because they're mostly unconscious for the procedure. The people mostly struggle with the fact that you have to have a preparation beforehand to clean the colon out, and nobody likes sleeplessness and diarrhea, so that's the drawback. The procedure itself usually takes about a half an hour. It's done under we call it moderate sedation, but people don't really experience discomfort during it. Most people don't even remember it being done, and then afterwards, the next day they're back at work.
Mm-hmm. Are there good alternatives to a colonoscopy?
I do think that the stool test, especially the Cologuard test, is a reasonable place to start for people who just seem to can't bring themselves to get a colonoscopy. It is not as effective as colonoscopy, and for every positive test, in which case some of those will be false positives, you still need a colonoscopy. So I do think that the stool DNA tests are valuable. Anything that starts the conversation, anything that gets people access to the system, I think is a benefit.
So I've seen commercials for Cologuard on TV. So as just an individual, can I call and order one and do that on my own, and then assuming it's negative, I don't have to worry?
You can if you want it to be covered with your insurance or with Medicare. It's supposed to go through a physician.
Okay.
Okay. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you sick and tired of waiting at the big chain pharmacies for your prescription? We've all been there. You aren't feeling well, and you go to pick up your prescription, and you're told to come back later. At the Medicine Center Pharmacy, you don't have to wait. We can fill your prescription in 15 minutes or less, and we could even save you some money on your prescriptions. Talk to your Medicine Center pharmacist at any one of our locations in Canton, Louisville, Minerva, and New Philadelphia. Visit medshoprx.com for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. A locally owned Health Mart pharmacy, whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you.
Welcome back to Health Matters with the Medicine Center Pharmacy. March is Colon Cancer Awareness Month, and today we're talking about the importance of colon cancer screening with Dr. Russell Ramey and cancer nurse navigator Angeline Barbado from Mercy Medical Center. Have a question, post it on our live Facebook feed or call us at 330-450-1480.
So, Angeline, in a minute we're going to talk about signs and symptoms of colon cancer, but can you tell us what a nurse navigator does and how they help someone who has been diagnosed?
Sure. The Mercy Cancer Nurse Navigators, the role is basically to be there as a support system, a support person, and the familiar face for patients during either a new diagnosis or a diagnosis that along the way they might need some assistance. And we try to get involved in their care early on in their diagnosis when it's the most overwhelming. And I like to, make sure I tell my patients that I know what they're going through is overwhelming, and I want to be that familiar person, can help guide them with any questions that they might have. We're there for their families as well, and just kind of follow them throughout their role, let them know what to expect, and that type of thing. So it's definitely a great part in the overall care for the patient.
So education as well as support.
Definitely education. And if they have any questions that, even if we're not able to answer, we can certainly find the resources necessary and come to them just to help calm them down. And we don't want them stressing out over that type of thing. We want them to just focus on their care, what they're getting at that time, and doing what they need to do to get better. So.
Well, I'm sure it's a very emotional time for families.
Definitely.
And the patient as well. So just being a voice of reason and calmness, I'm sure, helps a lot.
Yes, it's a very rewarding role. So.
Oh, I can imagine. So can you tell us about the signs and the symptoms of colon cancer?
Well, oftentimes it's asymptomatic, hence the importance of screening, but the position of the tumor within the colon changes symptoms. So right-sided colon cancers virtually are asymptomatic. They usually don't cause bleeding, though they might. Symptoms can be very nebulous, like fatigue. Who's not fatigued? And if a colon cancer is more towards the left side, then sometimes they'll have some early obstructive symptoms. They'll notice a change in stool caliber that persists, or they'll develop some abdominal distension or pain, some form of change of bowel habits. Most common would be bleeding, however.
So we have a question from a caller in Canton, and she said, why do people who are over the age of 75 not need a colonoscopy?
Well, it's not necessarily true that they don't. Those regulations are basically for screening, which is different than surveillance, which is different for high-risk groups. So if somebody is at average risk and have never had colon polyps before, then the recommendations are 75, because the odds are that even if they had polyps, those polyps wouldn't have enough time to turn into cancers that would then be life-limiting for most people. Appreciate, though, that that's a strong economic bias that develops those statistics.
But there's virulent forms, aren't there, of colon cancer that all of a sudden, boom, they just take off?
There are colon cancer growth rates are not that predictable. I've had numerous octogenarians that were hugely insulted that they were declined for colonoscopy because of their age, and then they got colon cancer.
Oh. That's just sad to hear. So if it's often asymptomatic, as an individual, what signs or symptoms should cause me concern that I should bring to the awareness of my family physician?
The most common would be blood in the stool. Anything that's unexplained weight loss, unexplained change in bowel habits. But the best criteria are the screening criteria. People don't get symptoms if they get screened. They don't have time to.
So we hear a lot of talk about polyps. And what is a polyp? My perception is that that's the beginning of the growth of a potential colon cancer.
It's true. One of the advantages in colon cancers compared to other cancers is there's a fairly predictable sequence of events that starts with normal and then leads to benign polyp and a polyp with dysplasia of mild, moderate, and finally severe degree before it turns into actual colon cancer. So we've got lead time, we've got predictability on our side.
During a colonoscopy, okay, if they find polyps, isn't it typical that they kind of cut them off?
It is.
With a loop or something?
That's true. We have different devices through our colonoscopes that we can remove most polyps unless they're too large or in a poor location.
I'm thinking of it like a lasso where you just throw it over pull that baby and trim it right off. Is that true?
Slightly more technical, but you're on the right path.
I'm trying to make it simple here.
You're very close, Paul.
We have to worry. He may want to try to perform one in the near future.
All right. I guess it's our second break. You listen to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacist can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's StudioArtsandGlass.com.
Have you seen our new arrivals at the Half Off and Hot Buy store in Louisville? A great selection of spring clothes for men, women, and children. This is a great time to stop in the Half Off and Hot Buys to see what's new. Lots of spring toys, and it's getting close to Easter. You'll see a lot of Easter Bunny stuff like eggs, baskets, and lots of Easter decor for the season. So get over to the Half Off and Hot Buy store in Louisville next to the Medicine Center Pharmacy, where our quality choice products are still buy one, get one free. Find us on Facebook, Instagram, and halfoffhotbuy.com.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we're talking about colon cancer with Mercy Medical Center's Dr. Russell Ramey and cancer nurse navigator Angeline Barbado. We've got a lot to cover this morning, so let's get back to the show.
So can you tell us what kind of treatments are recommended for colon cancer?
Well, it depends, Nancy, on the stage of diagnosis. So early stage colon cancers are primarily treated with surgery alone, and then you have a surveillance protocol to follow. If it's a later stage, then chemotherapy may be a part of the treatment program, and then going forward, sometimes people are involved in cooperative studies. Radiation is not typically used for colon cancer. Radiation is useful for rectal cancer.
How effective are the treatments?
Extremely effective. Most of the early stage colon cancers are cured. There's a 90% cure rate for localized colon cancer.
What about side effects of treatment? And then also, if you might want to talk about what recovery is like after surgery.
Well, many of our surgeries today are done in a minimally invasive environment. So most of the time these days, I'm doing these surgeries robotically, and patients who used to be in the hospital 7 or 8 days are home in a day or two, and their recovery at home is a much more abbreviated process. What we've also found is not only do people get better faster, they also have fewer complications. So it's not just a faster recovery, it's actually a better recovery. There are side effects of the other treatments, of course. I think there are misconceptions about chemotherapy. People think that chemotherapy is one thing, and in fact there are many different types of chemotherapy. Some are incredibly well tolerated. People pass folks in the grocery store daily that are going through chemotherapy for one type of disease or another and don't even recognize it because they look so normal. So I think that that if people understood the details of it, I think it would be less frightening.
Angeline, is your job almost just beginning when the patient is ready to go home from the hospital?
I do like to try to get involved even before their surgery, if possible. That way, I like to visit them on the morning of their surgery, and that familiar face can really just calm them down as well. And then we do follow them throughout their treatment, so even after they've recovered from surgery and if the possibility of chemotherapy is in their future, that goes with the education component again. We do try to educate them on the potential side effects that may occur, and just preventing those side effects by just communicating to your physician that this has occurred, then that way it's going to, we would be able to control that better for the patient during their treatment as well.
Do you have appointments with patients?
We do. Patients can come in by appointment. They can always meet with a nurse navigator. If they're inpatient, we do round throughout the hospital at Mercy Medical Center just to visit with them and their families. If they're going through radiation or chemotherapy at Mercy's Infusion Center, we will go over there as well. Just kind of follow up with our patients and aware of their appointment times so we can be there as that familiar face. Yeah.
Thank you for that. That is just really nice to hear.
Yeah.
If necessary, during the colonoscopy, in past years, a lot of colostomies were done external. would that type of surgery be moved to another surgery if you discovered a lot of damage, or not?
It's actually very uncommon to have a colostomy after diagnosis based on colonoscopy. Usually the people who have colostomies, even transiently, have rectal cancers or they have obstructing colon cancers, so somebody who didn't get screened until it was very advanced.
Full-blown tumor or something like that?
An advanced tumor causing obstruction would be one indication, but we don't do many colostomies.
Okay. The other thing that seems to be happening is that more internal colostomy as opposed to external are being done. Yes, no?
Well, most of the time we can reconnect the colon at the time, and in years past it wasn't as doable.
Exactly. Okay. So can you tell us a little bit more about the robotic surgery and how we make this happen?
Well, robotic surgery is basically taking the advantage of laparoscopic surgery, doing surgery remotely through small incisions with small tools, and really just taking it to a much higher level. Our laparoscopic equipment was all rigid instrumentation. It didn't articulate, which limits the angles that you can work at. It limits your dexterity and what you can accomplish. The robotic platform gives us a much higher ceiling for our capabilities, our dexterity, because it has articulated motions. It has wrists and elbows, essentially, and a robotic wrist will go 540 degrees as compared to my wrist, and so it just allows us to have amazing capabilities. At Mercy, we have 2 robots, actually, and we keep them fairly busy.
Training. How do we get trained on one of these Da Vinci units?
Yeah, that's a good question. Right now, training has a lot of variability in it. There's some core training that you go through with the company people that build the robots, since they are the ones that have to teach you the details of how it works. But there's many other levels of training. I actually traveled to several different parts of the country to learn robotics from people who are just considered industry leaders.
So what's new with what's coming next with the robotics? Do we have any idea?
Many things, actually. We get new instrumentation for the robot. The current platform is a platform that is so good that they plan on, for the short term, just adding new gadgets to it. In the future, we're going to have haptics. We're going to be able to feel through the robot. We're going to be able to have better force control through the robot. There's the visual display that we have is 3-dimensional as compared to laparoscopic, which is 2-dimensional, and that just gets better and better. It also has a lot of simulation opportunities, so people can simulate the surgery and do it as if it was the real live surgery before the actual surgery.
Are all the people that the Da Vinci is used on awake, asleep? Or
they're all under general anesthesia.
Okay, so they don't see the octopus on top of them. The reason I say that, I just happened to see a picture of one, and we talked about this earlier on before the show started, and I looked at that thing and I thought, man, if I was alive and I looked at this thing on top of me, so, okay. So is everybody a candidate for robotic surgery?
The vast majority of people are, yes.
Children?
Yeah, it is being done in children.
Okay.
It's a little different. The working space limitations are very real, but they are exploring it in pediatric surgery.
Do we have as many technicians, surgeons in the operating theater with the robot as before, or less? The
personnel is essentially the same. We have the same number of people in the same roles. We just organize it differently.
Okay. So let's say you have a patient that's 50 years old and has never had a colon cancer screening. What would you say to them?
I would just tell them to do it. I would educate them as best as I can and tell them to go ahead and get screened. If I, as one of Mercy's navigators, can help give them access to screening or give them a pep talk to kind of calm down any insecurities or reservations they have in getting the screening done, I'm happy. I can be pretty persuasive, so I would just encourage them to go ahead and get screened.
A lot of people say no. I'm not going to do this.
They do. And for me, that's when I pull out my Cologuard card and play that one. Since it's definitely second best, but it's
even though they might have insurance.
Yes,
they're saying no.
Yep.
That's pretty amazing.
Is the preparation the biggest concern or turnoff? Do you think that's why people are saying no?
I think so. I think it's part of it. I think, as Angeline was saying before, it's just not something that people want to talk about. They have an ostrich technique for dealing with this. They just stick their head in the sand and hope it doesn't cause a problem. I find that people are very undereducated about colon cancer as compared to other cancers. People are surprised when I tell them that their smoking is a major risk factor for colon cancer. They don't think of it. They think of that as being a lung cancer only kind of problem. And so they just hope it doesn't happen to them.
Wow.
So what are we doing this month to, at the hospital to info, whatever, on Cancer Awareness Month for colon?
Well, the nurse navigators always put together events, education for our patients and staff as well. We do have other support groups that we have a support group that actually meets the second Thursday of the month at Mercy Medical Center. Something exciting that we're doing with the support group this year is we're trying to bring in speakers or have an activity for each support group. And for example, this March's support group, we are having a music therapist come in. So again, we're just trying to promote overall health and trying to give them a type of therapy when they're going through this diagnosis and the difficulty of the cancer itself.
Are there lifestyle changes for patients after they have colon cancer and treatment and surgery?
Sometimes it's amazing. People who couldn't change their diet before now somehow can find it within themselves to change their diet, and they're oftentimes people who are much more likely to have home-produced food, fruits and veggies, and they're avoiding the processed foods, and they're avoiding the fast food places when they just couldn't bring themselves to make that change before. Certainly people do have a refocus on health and exercise, I think, after they've faced a diagnosis like that.
Is there any research being done as far as colon cancer treatment and prevention?
There are thousands of ongoing studies right now, and Mercy Medical Center participates in numerous studies. It's an exciting time. It's one of the things that I find very optimistic about medicine in general, is that it's all exponentially improving. We always gain more, and science is, by its very nature, exponential. We're doing better and better.
One of the dietary things that's come into play in the last few years is fiber, and they encourage you to consume more fiber. Can polyps be swept away by diet, any sort of diet, bulk diet?
It's probably preventative. Since some of what we eat has toxic substances in it, the contact time with the lining of the colon means that toxic substance then is exposing the colon for a greater period of time. Because of how fiber works in our system and because it increases the frequency of bowel movements, there's less contact time of those toxins.
So fiber, water, or liquids, or fluids, or whatever.
Yep.
Non-alcohol, no smoking. What's left, it can't do anymore. Okay. Listen to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Have you seen our new arrivals at the Half Off and Hot Buy store in Louisville? A great selection of spring clothes for men, women, and children. This is a great time to stop in the Half Off and Hot Buys to see what's new. Lots of spring toys, and it's getting close to Easter. You'll see a lot of Easter Bunny stuff like eggs, baskets, and lots of Easter decor for the season. So get over to the Half Off and Hot Buy store in Louisville next to the Medicine Center Pharmacy, where our quality choice products are still buy one, get one free. Find us on Facebook, Instagram, at halfoffhotbuy.com. Are you sick and tired of waiting at the big chain pharmacies for your prescription? We've all been there. You aren't feeling well, and you go to pick up your prescription, and you're told to come back later. At the Medicine Center Pharmacy, you don't have to wait. We can fill your prescription in 15 minutes or less, and we could even save you some money on your prescriptions. Talk to your Medicine Center pharmacist at any one of our locations in Canton, Louisville, Minerva, and New Philadelphia. Visit MedShopRx.com for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
When we hear the word pharmacy, we think prescriptions, right? Hi, Paul White for the Medicine Center Pharmacies in Stark and Tuscarawas counties, a locally owned Health Mart pharmacy. Of course we carry prescriptions, but our stores carry way more than that. We have a large selection of ostomy and diabetic supplies and compression socks. All of our pharmacies carry a variety of canes, walkers, bath seats, rollators, and commodes, all at super low prices. Our rollators are only $69.95. Call or stop by our local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you. Welcome back to Health Matters with the Medicine Center Pharmacy. Today, we are talking with Dr. Russell Ramey and cancer nurse navigator Angeline Barbado from Mercy Medical Center.
So, Angeline, I understand that Mercy has won 4 consecutive Outstanding Achievement Awards. Would you like to tell our listeners about that?
Sure. This is something that we are very excited for. It's the 4 awards for you that we like to promote at Mercy Medical Center. It's a very, like as Dr. Ramey was saying, unheard of, and it's a great achievement that Mercy has led their cancer treatment to get these awards 4 consecutive years in a row. So,
and I understand it's very rare.
There's only 16 hospitals in the country that have matched that.
Wow. Well, congratulations to both of you.
Thank you.
How about clinical trials? Is Mercy involved in any clinical trials?
We are. It's actually great to know that you don't necessarily have to travel to get access to those clinical trials. There is multiple clinical trials happening right at Mercy Medical Center. We do have clinical trials nurses available for questions, and if it's something that the physician or the patient is interested in, they do have access right there as well, so it's great.
It's awesome. And you have a new program called One Call?
Yes, we've implemented a one-call line for both patients and physicians as well. It kind of eliminates the multiple phone calls that go into an overall care. Patients are able to just dial in, and they're actually transferred to a navigator, and we can just feel out what's their issue, give them the resources that they need to prevent them from making all these phone calls and really not getting anywhere. We don't want them to get frustrated in the process, so if we can take that stress and help get them what they need right then and there, that's the goal of the one-call line.
Wow, that's pretty amazing.
Yeah.
So, contact information. Before we get too late, I don't want to miss that. Would either of you like to share contact information if any of our listeners have questions?
Sure. I just want everyone to know that Mercy Cancer Center is here for you. We are available on weekdays, usually 8 a.m. to 4:30 p.m. You can make an appointment in with the nurse navigators, and you can contact us at 330-430-2788 or cantonmercy.org.
Dr. Ramey, single most important piece of advice for our listeners.
Get screened.
Cologuard or?
Colonoscopy.
All right.
We should have brought a dietitian along today, I think. Tell everybody, okay, you can eat this, but you can't eat that. That's amazing. So, when did we first start to do colonoscopies? How far back are we?
Well, colonoscopies actually were limited to the left colon, and it was actually done with a rigid scope before the development of flexible fiber optic technology. So in the late 70s, early 80s, when flexible fiber optics became available, that's when flexible endoscopy really was born. And that gave us access to the entire colon at that point.
Equipment continues to improve?
Absolutely. Visualization is much better. Now it's done with camera microchips. It's a completely different technology, but that was when it all started.
Well, what do you think the next improvements could be in colonoscopy techniques?
I think that robotics is going to have a role in endoscopy as well. They already have experimentally done colonoscopy with mobile devices that can move through the colon retrograde, as compared to capsule endoscopy, where you swallow a camera microchip and it goes through antegrade.
No on the swallowing thing, or?
Usually we use that for small intestinal disorders, since the small intestine is difficult to get to procedurally. It's not as effective nearly as colonoscopy.
So it's still in play. I remember reading about it some time ago. And,
it is.
Oh, well, in the next future you're going to swallow this little pill and it's going to tell you everything that's wrong with you, And is that coming?
No, it is still in use. It's just not very effective. The colon needs to be distended in order to see all the walls clearly. You need to have the prep to clean the colon walls, and so it needs to be a directed journey through the colon, which the capsule tumbles through as it goes. But they're already working on devices that will allow people remotely to direct it.
So does the prep? It cleans the bowel, okay, but does it actually distend the bowel then? Is that what you're telling me?
No, when we do colonoscopy, we insufflate the colon with air to distend it.
Okay. And that gives you a full-blown look at it?
It does.
What if it doesn't blow up?
It does blow up. Tips and tricks.
No, I'm just thinking about some disorder, or maybe they're more diseased.
No, that's true. There are conditions of the colon that lead to more spasticity of the muscular wall, so it doesn't distend as well, but it still distends.
Okay. In the past, I remember many people coming into the store and saying, well, gee, I just had bowel surgery, and they cut me all, clear across here or down there or whatever. Is that common still, or is that gone?
Mostly that's in emergency situations. Now the vast majority of this, if done at advanced centers, is done in a minimally invasive environment.
Sure. That's wonderful. Okay, we're running out of time here. What else would you like to bring to the table?
Eat your fruits and veggies, avoid processed food, exercise, and get screened.
Mm-hmm. So you mentioned earlier that you've been doing this for about 25 years. What would you consider to be the greatest change that you've seen in your field since you started?
Wow, we're just light years beyond where it started. The chemotherapy advances alone. When I was in training, we didn't have a 5-year survival rate for people who have stage 4 disease. It was measured in months. Now we actually have describable 5-year survivals for people who presented with stage 4 disease. It's just incredible. It's a completely different world than when I trained.
So there's hope.
Absolutely.
The chemotherapy thing is, I remember when some of the docs are using orange juice and fluorouracil, and they'd break an ampule and pour it in the glass, and that was for colon cancer.
Wow.
Still doing that?
Not so much, Paul.
I was amazed when I heard that back then. So, okay, thank you very much, Dr. Russell Ramey, and Cancer Nurse Navigator Angeline Barbado from Mercy Medical Center. We'd like to thank our listeners. And if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Mercy Medical Center, Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. We are a local Health Mart pharmacy caring for you and about you. Have a healthy week. We see you back here next Friday at 9 a.m. on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.